Hello. So today I want to talk to you about managing interruptions. Um, and I know I say this a lot, but this is a topic that's quite close to my heart, and just purely because it was like a day-to-day part of my job in the years that I worked in, particularly in emergency medicine in A&E departments over the years. Um, but yeah, that was just the nature of the job. Like, it's not really the kind of job where you can sit down, do one task to completion, move on to the next one. It's essentially that job is essentially a constant prioritization and reprioritization, and that's really the kind of mindset that you needed to get into to to kind of thrive, I suppose, in that environment. And it tends to attract a certain personality, uh, because it tends to be the kind of person where actually you were never a massive fan of being on ward rounds that lasted 4 hours, um, or maybe even going to clinics and stuff. Although there are in some places there are clinics associated with being an A&E doctor. But yeah, this is always one aspect of the managing the kind of mindset and the sort of non-clinical side of the job that really fascinated me. Was like, how do you effectively manage that, because it is an inevitable part of the role that you cannot remove. You've got an open door there where anyone that needs medical help of some kind can present. So you could be in the middle of something and then need to drop that to go and deal with something else. It's really tricky, and there's systems in place, kind of bigger picture system in place to make sure that as people are arriving, that they're assessed and they're kind of placed in categories, and those categories can change sometimes, and are they fit to sit in the waiting area, or can they go straight into a room, or actually are they in need of immediate attention? So there's all sorts going on. So that was kind of, it was a bit of a kind of double-edged sword. So you would show up for a shift never really knowing what you were going to be dealing with on that day. But you could almost certainly guarantee that what you weren't going to be able to do was do sequential pieces of work. Going, I'm going to sit down, I'm going to do one piece of work, and then I'm going to finish that and move on to the next bit. And people who like to work like that, people who prefer to work like that most of the time, generally found it quite difficult in A&E. And certainly earlier in my A&E career, when I was less experienced, that was one of the sources of stress and irritation for me. And this is coming from someone who's generally described as quite easygoing, quite laid back, take things in my stride. Um, I can't remember whether I've talked about behaviours under stress yet or not, but that would be one of the sources of me getting, if I was going to get a bit irritated on one of those rare occasions, it would usually be about getting constantly interrupted. Um, so there's research, as there often is, in these kind of things. There's research being done that shows that interruptions are a bit of a significant problem, and it's highly likely. I can't remember the figures, unfortunately, because my brain doesn't work that way. But there's figures that suggest that the task that you were doing will take significantly longer if you get interrupted, and also there is a chance that you won't get back to that task at all. So there's a good chance that you won't finish that task at all. So it's not a benign thing. So some examples would be, on a daily basis. Now, not thinking about seniority, but just as an A&E doctor, there'll be things like, someone will, a colleague will want some painkillers prescribing for someone that's maybe waiting to be seen. Someone will come in, they will want, when they do ECGs, so tracings of the heart, those need to be looked at by immediately after they're done, just to make sure there's no immediate action needed. So you're constantly getting ECGs put in your face to have a look at and sign. That's kind of a safety thing. So that's an everyday interruption. And then obviously you've got concerns as well. So you'll have your nursing staff usually, or sort of more junior members of the team, coming to you and saying, I'm a bit concerned about this person, and these are things that you need to kind of factor into your sort of prioritization and reprioritization. Easy for me to say. Um, again, so yeah, really, really tricky thing, and it got worse as you got more senior as well. And then when I got to the top of the tree as the consultant, then you're kind of the port of call for for all issues. So it was incredibly common to get interrupted all the time. So yeah, so how do how do you manage that? I suppose, and I remember years ago doing some research for a talk that I was going to be giving, where it was when I actually, yeah, it was the first year when I became a consultant, and I was doing some teaching with some of our trainees in the department that I worked in, and often I would choose to teach them on topics like this, where it was kind of non-clinical stuff that I never really got taught and kind of had to learn how to manage it myself. So I'd done a little bit of looking around and I'd found a couple of articles. And it's a very straightforward model of potential responses that you can use for managing interruptions, because that's really what it is. You probably can't eliminate interruptions, so you need to manage them. Um, so yeah, that actually just gave me another thought. I remember years ago that there's certain tasks where actually an interruption should be avoided almost at all costs. I don't want to say always, because there's always the potential for for there to be something time critical and more important. But if yeah, so actually bear with me. I'm just a human recording a video in real time, and I like to keep these as kind of raw and unedited as possible. But before we get to the model, there's kind of a planning element to this as well. So if you're doing one of these tasks that's a kind of critical um, safety task, I guess. So if you're doing a sensitive procedure, then obviously you're not going to want to be interrupted doing that. So if you think about surgeons operating in theatre, they will have a very, very, very low tolerance for being interrupted while they're operating, because that's a really kind of safety critical thing. Years ago, they recognised that there were certain nursing tasks that were safety critical as well, that the nurses should not be interrupted during, and that was like medication rounds. And so that you'll see, if you ever go into hospital as a patient, God forbid, or if you're in visiting a relative, if you're in during medication rounds, you will see nurses wearing tabards a lot of the time, saying, doing medication rounds, don't interrupt me. And certainly in A&E, you would need to be aware of that as well. So if I was doing a procedure, like if I was inserting a chest drain or something like that, I can't really be interrupted during that. I once had someone try and interrupt me when I was doing a procedure called a cardioversion, where someone really unwell, who I was having to deliver an electrical shock to reset their heart, and someone came to start asking me a question during it. And I don't think I was too irritated. I think I kind of turned around and I said, "Is this an emergency?" And they said, "No." And I said, "I don't really think now is the best time to talk about this." And then we kind of, we addressed it in a good way. So you just need to be aware of that, and you need to put something in place to kind of make it aware to people that, look, I cannot be interrupted during this. So there's kind of a planning element to it to some degree, and then there's the D's. So there's the three D's that are your options for how you can manage an interruption. So the first one is to decline. So if someone says, can I just, can you look at this ECG? If you're in the middle of something really important and don't have the bandwidth for it, then you say, I'm really sorry, I don't have the time or the brain capacity to deal with. Could you possibly try someone else? Do that very politely. Don't be a DICK. Defer. So you see someone wants to interrupt you and you say, can you just hold fire for a couple of minutes, or just wait until I finish this? So I used to do that sometimes if I was writing notes or if I was prescribing something. I'd say, can you just wait until I'm finished doing this prescribing, or until I finish this section of my notes, if that's okay. And then do is the last D, essentially. So you fully engage with it and you go, what do you need from me? Obviously you just need to make people aware that there's kind of a team preparation and communication thing. We say, if this is a really important thing, then you need to make that clear to me in your opening sentence so that I know whether I need to stop doing what I'm doing. Okay, so plan and use the Ds. I'll see you next time.